Hello everyone and welcome to my channel. In this video we will discuss about the different types of rashes in babies and children. Some of these rashes are associated with fever and some are associated with itching. So let's discuss. There are many things which can cause a rash in babies and kids, and they are mostly harmless. If your child has a fever and a bright red rash on both cheeks, it can be slapped cheek syndrome, or it's also called fifth disease. Your child may have a cold and the rash can spread to the body. The rash usually clears up within a week. To subside the fever, you can give paracetamol to your child. If your child has a fever, sore eyes that are sensitive to light, and grey spots inside the cheeks, and after a few days, a red-brown rash appears on head or neck and spreads to other parts of the body, then this indicates that your child has measles. You need to consult your doctor if you suspect measles in your child. If your child has pink red rash which looks like a sunburn and feels like sandpaper, this may be scarlet fever. It usually starts with a swollen tongue, sore throat, headache and fever. See your doctor if you suspect scarlet fever because it's treated with antibiotics. Another common childhood illness is hand-foot-mouth disease that causes blisters on hands and feet and ulcers on tongue. It also causes fever if your child has a cold. It usually clears up within a week. To subside the fever, you can give paracetamol to your child. If your child has a raised, itchy, red rash, it indicates hives. It can appear as an allergic reaction to certain things like stings, medicines or food. It usually clears up within a day or two. You should consult your doctor if your child keeps getting on this type of rash. If your child gets swelling around his mouth, seek medical attention immediately. If there is an itchy, ring-like rash on your child's body, then it's diagnosed as ringworm. You can use antifungal cream or lotion to treat it. See your doctor if this ringworm appears on the child's scalp, as it may be treated with medicine. Another type of rash is chickenpox, which causes red spots that turn to blisters. They can be itchy and they eventually scale and fall off. If your child has red sores or blisters that burst and leave crusty golden brown patches, then it could be impetigo. They often appear on face, hands or around the middle of the body. These blisters can be itchy. They can get bigger and spread to other parts of the body. Scabies is another type of rash that is caused by tiny mites that burrow into the skin. Anti-scabies cream or lotion should be applied to treat scabies. Everyone in the household needs to be treated at the same time, even if they don't have symptoms. Consult your doctor for advice if your child is under 2 months old. If your child's skin is itchy, red, dry and cracked, it may be eczema. It's common behind the knees, elbows and neck, but it can appear anywhere. Heat and sweat can cause small red spots known as prickly heat or heat rash. It itches, so you may notice your child scratching. Heat rash should clear up without treatment. You must see your doctor if your child seems unwell and has a rash and a fever. You must take your child to the emergency service if he has a rash and has a stiff neck, he is bothered by light, seems confused, he is shaking uncontrollably, has a fever that's not subsiding, has unusual cold hands and feet, has a rash that doesn't fade when you press your fingers against it. All these can be signs of meningitis. I hope you liked this video. Take care of yourselves. Thank you for watching.